What's happening with tuberculosis? The updates are not very happy to understand. First of all, we explain in tuberculosis overcrowded, lower socioeconomic, and highly infectious in malnourished. The trend seems to be changing. Again, I call IT crowd getting into tuberculosis. Every second infertility case or third or sixth infertility case, you can relate it to tuberculosis of the endometrium or the uterine, the bed of the baby bed, what we call endometrium, is also infected, because I think the TB bacilli work pattern, if you see how TB works in you, all of us are infected with tuberculosis because we live in India. We inhale at one point or the other in a crowd. But why all of us are not affected? That's because we have it in us, a system called immune system. The cells which are fighting constantly against this tuberculosis, keeping it on a high alert mode. What happens when everything is changed? The circadian rhythm and the immune system works superb or excellent with the basal metabolic rate, which starts early in the morning till the noon maximum and comes down by evening. That also explains evening rise of temperature in tuberculosis. When the steroid levels are dipping, when the immune system is going into a sleep mode, our body is working in the IT industry through the night, through the early morning hours, where your brain is supposed to rest, giving immune system a rest. The same cells which harbor the TB bacilli, who are supposed to be killing, allow them to grow in them. So, we have cases where intestinal tuberculosis in the ITs, we have lung tuberculosis in the ITs. I have seen a lot of vertebral tuberculosis, spinal tuberculosis, and I see cases which are multi-drug resistant and tuberculosis of the uterus. Infertility is like the moment we see infertility for 2-3 consecutive IVFs, we do endometrial culture or PCR for tuberculosis, and 80-85% of the time it is positive. It's very alarming to see a well-educated, well-nourished, richer class is succumbing to tuberculosis. This is not a good news for us, because TB in them is also known to be multi-drug resistant because of some of the drugs that we take routinely among the upper class or upper middle class. We use a lot of ofloxacin. Some of these fluoroquinolones which we use render tuberculosis resistant to most of the basic drugs. So, be on high alert. If you have a kind of cough, body ache, backache, abdominal discomfort and some kind of infertility, please get yourself checked for tuberculosis. This is a serious issue, serious concern. WHO is also addressing it. Even CDC Atlanta is addressing it in the newer generations.